Tuberculosis has claimed over 1 million South African lives since 2010. This was just one of the issues discussed at the week-long SA-TB conference in Durban. Delegates also looked at advances in drugs, diagnosis and vaccines. Let's discuss this now with Deputy Health Minister Sbongiseni Dhlomo. A very good morning to you, DP, and thank you, DM rather, and thank you so much for your time this morning. I mean, you know, when you look at what's happened with COVID-19 and the number of lives that have been lost in just the last 2 years, and you compare it to TB and the number of lives that have been lost in the period of 12 years, you would think that TB isn't really that deadly, isn't really that dangerous, isn't something to be as overly concerned about as you would be perhaps with COVID-19, with cancer, with even malaria. But TB is a serious issue, especially in this country. It is one of the biggest killers of South Africans, is it not?
Good morning, Mothupi, and good morning to your viewers. Exactly correct. Maybe it's because COVID-19 affected me, you, and many others who probably have not been actually thinking that infectious diseases can also touch them. It touched many countries and many important leaders in the world. As we're summarizing the conference yesterday, in a lighter note, but much more important, we said maybe it's a payback time now for COVID-19, the efforts and the contributions, all the hard work that our healthcare workers, everybody put in behind COVID to where it is now. It's probably the same effort we need to put even more for TB and many other programs that have since been delayed because of that. Yes, you are correct. It kills so many, 61,000 people in the world per annum. That's a very big number. If you actually look into that, we should be doing much more than what we are doing for COVID, for TB, a similar way that we did for COVID and other illnesses.
How much attention is being put on fighting TB, Deputy Health Minister? I mean, we are always going to compare, at least in the current discourse, all of these illnesses, diseases and viruses and such to COVID-19, because we did not know what we were dealing with until it was, as some would say, until it was too late. You know, lives were lost. Our loved ones, lost their lives because of COVID-19. When by the time we got it under control, millions of people were already gone. So we'll always compare everything that has already been existing to COVID-19. But as you've rightly said, that it's now with how we've dealt with COVID-19 allowed for the likes of TB to get the attention that they deserve. But before COVID-19, how much attention was TB actually getting here?
It was actually, in many countries, it is actually being declared as a crisis, and in the sub-Saharan countries also too. But let me just give you another scenario. Maybe a lot of us have to be corrected, and we have accepted that correction as healthcare workers, that TB is more than just a biomedical disease. It has a lot of social, political, and economic impact. If you were to be a TB patient in an overcrowded one-roomed house, everybody in that house is going to actually be affected. So it means human settlements come into the picture. TB, unfortunately, has also been leaning on unemployment, poverty-stricken communities because there are very few resources to go around. And again, you need to have a support of that family for that one person on treatment so that they can complete treatment. And me and you, males in particular, are very reluctant to come for facilities. So if there is one man in the family who has come back from mines with TB and it goes into the whole family and the village, the whole family, so we are not being able to trace those patients who otherwise should be on treatment and must be put on treatment and be followed for, of course, a very difficult situation. It's not like treating flu, 6 months on treatment every day, support them. That is why, among other things, in that conference, we're calling for shorter regimens, much more effective than this 6 months, 9 months long protracted treatment that makes some of the people just default on that.
Now, Deputy Health Minister, of course, the focus now, at least after the conference itself, is what can we do more going forward? We have got a pandemic, which is the TB, that we need to be fighting. So what are some of the resolutions that you as the Deputy Health Minister, are happy with and are looking to zone in on and focus on going forward? Because it's one thing to sit at a conference for a couple of days and discuss, but at some point there needs to be effective implementation. So what's the next step?
Two major resolutions that came in from the conference. One is that we agreed unanimously that there should be and there is a TB recovery plan, and that is a very big package of what needs to be done faster, and it was actually agreed upon by academics, by researchers, by politicians, and members of parliament who were there, civil society. All of us agreed on that. Number two, we are finalizing a national strategic plan on the HIV, TB, and STIs for the period starting 2023 to 2028. And our desire is that more consultation, a lot of consultation has been done, but if you and me still have to want to add more, we can then approach the Secretariat of both SANAC and the Department of Health. And we are hoping that in the 2023 March World TB Day, the Deputy President then will unveil this national strategic plan that we are already beginning to work on it. We have been educated on it by a lot of inputs that come from everybody else, including other sister departments, like the presence of a Deputy Minister of Basic Education in that meeting, the presence of a Deputy Minister of Social Development is actually talking to this being just more than a biomedical disease, but needing everybody, every leader in the government, including the presence of the mayor of eThekwini, actually highlighting key important programs, because we are looking after residents that are within councillors, within communities, so where we need to make an impact.
Deputy Minister, we can't not touch on this. It's something that actually has raised some concerns for a number of people in and around the health fraternity. The matter of 8.5 million vaccines potentially being destroyed by the end of October, of course, as they come to their expiration. I mean, this is something that the Health Minister, Dr. Joe Phaahla, had confirmed. I mean, there are those who feel that this is an indictment of just how poorly handled, COVID-19, its communication, its drives for people to go out there and get vaccinations has been. Could this have been avoided? Could 8.5 million doses of vaccines not been destroyed or not being at risk of being destroyed come October? Has the health department done enough to ensure that this is not where we find ourselves?
Mothupi, you are a South African who was with us right through during this period. Every Friday, Minister of Health would be on air. Thanks for the space that you gave us to really outline where we are, what needs to be done. And there's been a lot of campaigns supported by Deputy President, the Minister of Sports, to say, let's go and get all the fraternal people, all in sports fraternity and everybody to support this campaign. There was also a call by the young professionals saying, "Ki ready, come join me, let's vaccinate." So we did everything humanly possible. The other scenario, Mothupi, would have been different, to say, here are South Africans lining up in all government and private institutions waiting for vaccines. And this government is just not offering vaccines. It's not available. We have vaccinated up to about, I think, 33% of South Africans. And we would have wanted to do much more. But if you look into those South Africans who actually were taking the message and were not really pressurized by either social media, the elderly, the senior citizens, 60 years and above, they are vaccinated up to 70%. It's the young ones, Mothupi, of your age, who are actually getting mixed messages and therefore rely on some of those messages that make them to be reluctant to come forward and vaccinate. But we still today say it is much safer to vaccinate. You are much more better, because we don't know whether there may be another wave. In any event, if you get the immunity into your body protection, you are much better than any other person in the event this pandemic has not come to an end.
All right. Deputy Minister, thank you very much, particularly, of course, on just touching on that and helping us understand, of course, the Department of Health's stance regarding the potential destruction of these vaccines. We really do appreciate your time, of course, here on the South African Morning. That is the Deputy Health Minister, Sbongiseni Dhlomo.